Good morning, everybody. Can everyone do a thumbs up if they can hear me okay? Okay, wonderful. So good morning, everybody. Welcome to our first weekly Town Hall Zoom presentation. I'm Emily Farber. I'm the Director of Social Services at Avenidas Kleiner Center. We are the Adult Day Health Program in Mountain View. Avenidas wants you to know that you are not alone during this challenging time, and all of our staff are providing critical support to make sure that you have your needs met. So please take a look at our website. It's highlighting all of our Avenidas Without Walls programs and resources. Also know that many of our recreation classes and groups are meeting online. For elder care consults or crisis intervention, we have the Avenidas Care Partners social work staff, Paula Wolfson and Thomas Kingery, and I will have their information up at the end of the program. Please note that this webinar is being recorded and it will be available on our website, avenidas.org, as soon as Monday, if not earlier. So please feel free to share this video with others who could not attend today. We do have 100 people signed up, and I know others are joining as we get started here. But I'd like to now introduce Dr. Mehrad Ayati. Dr. Ayati is an adjunct assistant professor of medicine at the Stanford University School of Medicine, where he teaches geriatrics. He's board certified in family and geriatric medicine, and he's the director of the Geriatric Center in Los Altos. This center is a unique second opinion clinic for elders and family caregivers who are concerned about their medication regimen, stress, mobility, cognitive, or physical health. Dr. Ayati is the co-author of Paths to Healthy Aging, and he's testified back in January 2018 before the U.S. Senate Special Committee on Aging. He spoke about challenges faced by the aging population in America, and he presented specific resolutions to these problems. Dr. Ayati is a community partner of Avenidas, and we've been lucky enough to have him as the keynote speaker at our caregiver conference several years back, and he's a regular guest speaker at the Monday Avenidas Caregiver Support Group. So at this time, I'm going to turn it over to him. Again, I do have everybody muted, just so we don't have too much back and forth. And at the end of this program, close to 12:30, I'll be coming back on and making sure that you have all the information about our upcoming programs. So bear with me a moment and I will turn this over to Dr. Ayati. Thank you so much for joining us. Okay.
Thank you so much, Emily. Do you hear me, everyone? Okay, perfect. Let me share my slides with you here. I'm just gonna have a quick presentation, and most of the time we're just gonna do more question and answer, which is gonna be something we wanna do. Again, I'm so pleased to be here. Thank you, Avenidas, Paula and Emily, for arranging this important discussion. There's a lot of questions going on regarding COVID-19. It's a big crisis right now. As a daily basis, I do one presentation for a different organization, and it's very interesting. This is my first time in my career that I have to change my slides every single day because the number is just changing, and we have a big crisis here. I mean, it's like from last night till this morning, we have a lot of change globally regarding the number of the patient infected, what's going on. The guidelines keep changing. I try to just quickly, let me just say, I think that's the wrong slide. Let me just a second. Avenidas frequently asked question. Just a second. I'm gonna do the right for you. Here we go. Okay. That's the one. Okay. Perfect. Now, these are more frequently asked questions. Maybe some of these questions actually you can have it right now and you can find your answers through that. I just wanted to go, the number one questions that everybody asked me about, that where is exactly the route of transmissions for this disease? I just want to say that you probably all knowing that the story started in December 2019 when there was a series of unexplained pneumonia happened in Wuhan, in China, part of the Hubei. And
Dr. Ayati, I'm going to pause for a moment. It appears that your screen has stopped sharing. So
I'm sharing. Let me just.
Beautiful faces. I'm not seeing the screen, so we'll get that going in a moment.
Let me just a second.
Thank you all.
Let me share again. Here we go.
Wonderful. Okay, thanks.
You have it now?
Yes.
Okay, perfect. It's the first questions here is asking about what is the route of the transmission, because a lot of people ask me about it. As I said, about in December 2019, there was a series of unexplained pneumonia happening in Wuhan. Everybody thought this is influenza because in last fall, in 2019, we had a lot of mortality due to influenza, both type A and B around the world. We had actually a lot in the United States. But the manifestation of this pneumonia was very different. In influenza, the people are not rapidly progressed this way. And that's why the first time they found, oh, maybe the SARS came back, which is severe acute respiratory syndrome that we have in 2003. And then they found, no, this is a new novel coronavirus, which is probably originated from the bat. Still, we're not certain about it because the patients number 0 never been found in Wuhan. But we think about, because of the vet market, which is the seafood market in Wuhan, probably the bat was the origin and was infected pangolin, which is kind of anteater. It's and then the skin of the pangolin actually can shed a lot of the viruses. And then what now, this is not animal shedding anymore. This is person to person right now, because as it became to the human, now the human to human is actually the main route of the transmissions right now. We had experience from 2003, 2012, and 2019 with coronavirus. We have 3 different types of the disease happen. As I said, in 2003, we have SARS. SARS technically has severe acute respiratory syndrome. It's kind of coronavirus is very similar to one we have today, but it's a little bit different in its structure. We had around 800 mortality total when we had SARS. With 2012, another coronavirus type of coronavirus, which we call MERS, which came from bat to camel and from camel to human, mainly happened in Saudi Arabia and Egypt, actually killed actually 250 people, but from 2,500 total, which makes case fatality rate of 34%. That was very actually killer. But the good things about MERS, that they're able to contain this virus so fast. But now we have SARS, which is, we call it first SARS-CoV number 2, and to February, WHO, World Health Organization, changed the name to COVID-19. So far from last night, the number of the people contaminated is surpassed of 1 million. And we have almost close to 50,000 fatality rates till this morning. Germany last night announced that actually it was really good in Germany for the last days, but for the last 24 hours, we had more mortality in Germany. We had above 1,000 mortality just in the last 24 hours in Spain. New York is still, as you probably know, is not doing very well. And we're expecting that probably the case fatality rate for this disease, because it's changing, it's something between 0.4 to 1.4, but it all depends on how many cases we have. We still don't have many cases because of the lack of testing. We really don't know how many people on the entire planet actually infected with this disease. I just want to quickly tell you here about SARS-CoV-2. I don't want to do all the things about it, but I just want to tell you something that is very fascinating about this virus. When we talk about coronavirus, as you see here, you see this spikes around this virus. This is exactly typical. this spikes actually help the virus enter to the cells. And what happened is when this virus comes to the cells, is technically use our system, like our lung system or bronchial system, as a slave, and try to produce as much as RNA as you see here for itself. Technically is a dictator and is a slave, and they actually using our cells to produce lots of baby viruses and make us very septic. As a lot of people says, what age gonna be involved? We all knowing that this virus from the time it started in Wuhan till today has been changed. Technically, this virus is gonna have 2 mutations per month. This is less than influenza. Influenza has 8 mutations per month. Some of the viruses has the faster. But from the beginning of this virus, the range it's been between kind of like adults of the middle age and older adults can be affected. But several cohort hospitalization patients with COVID-19, we found that median age is something between 49 to 56. And
Excuse me,
this is
I'm
the
listening.
age range that we have so far. But mortality, it's more in people with older age. Anybody above 60 years old, they actually have more. Emily, I think you need to echo to mute some of the other speakers. I mean, okay, not me. Do you hear me? Oh, okay. Oh, you hear me, everyone? Oh, okay, perfect. I see that. Okay, the issue is with people has older age. The main thing is actually the comorbidities. Anybody has history of high blood pressure, anybody has history of the heart disease, any degree of the heart disease, any history of the coronary artery disease in the past, they have 10% of mortality risk. Any history of the cancer, especially if somebody has old lung cancer in the past, anybody has history of smoking in the past, even former smoker, they have a higher risk of mortality. Anybody has history of the COPD or chronic obstructive pulmonary disease or chronic bronchitis, they have a higher rate of mortality. And anybody history of diabetes have like 6% risk of the mortality as well. In children, we found that actually this virus has a very mild manifestation, mainly mild symptoms, maybe some sore throat, a little bit fever, but most of the kids overall recovered in China. We had no mortality in Italy. We had 2 infants so far for the last week actually passed away in the United States, one in Chicago, one in New York. That brought a little bit brought this concern that maybe this virus is mutating. As you probably hear, there are more younger people, less than 20 years old, now infected for the last week in Russia and also in New York, which brought this concern that maybe the virus structure is changing and now even the young people can be also affected by that. But for sure, the mortality is less in the people in less than 20 years old, but anybody 20 above, it's more. As you probably hear, even in Santa Clara or many of our hospitals, we recently have more younger people to be connected to the ventilator. As far as the men, compare of the women, in both Chinese study and also Italy, we see more men involved. There's some of the theories researchers think about it. Number one is men overall, they have a more non-healthy behavior in their life. They will be more drinker, they may be smoker before, and less active compared of the women. The other thing, some of the suggestions, some of the scientists is women overall overall women have the stronger immune system against viral infection. And that's why probably one of the reasons the men is actually has more mortality compared to women. And the other thing is I wanted to share with you, which is going to be the question a lot of people ask me in different places, is about asymptomatic people. This is the nightmare. I can tell you as a physician, when we deal with any other virus infection, measles, influenza, or anything, viral infection, the people start to become shedding the virus and contaminating other people when they have symptoms. Like, for example, they have cough, they're sneezing, they have fever. This virus is very strange. The people, even asymptomatic people, they can have shedding virus and transferring to other people significantly. You probably hear in the last 48 hours, the new review of some of the reports around the world showing that even people that are COVID positive with talking or breathing can actually spread this virus around. This is exactly one of the reasons that last night in brief in Washington, in Oval Office, they were discussing about maybe entire people in community, they should have a face mask. And this is something that new guidelines will come in the next days. But I will say probably this is one of the biggest situations that we see so far for asymptomatic people. And it's very interesting because when you look at the next slide, in the study has been done in asymptomatic people, like for example, in China, they actually had like 24 patients with absolutely no symptoms, no fever, no cough, no body ache, nothing. And they did a CT scan on them, and they found 50% of these people have pneumonia under CT scan, even there's no symptoms that they had. And then 5 patients later developed some low-grade fever. Another study has been done in China, 55 patients, they were being absolutely healthy, normal, and no problem. And they did a serial CT scan. They found that they have a CT scan, they have pneumonia. And 67% of them, they have a pneumonia. This is one of the big concerns. If we do CT scan, a lot of people in the community today, maybe we find a lot of people that are positive. I will talk a little bit about CT scan if you have a question. But the thing about asymptomatic people, it's a very big issue. Everybody knows the person to person, it's the main cause of the situation through the respiratory droplet. And the same thing we have with influenza. With the droplet technically transmission, we know the virus is going to be released in or respiratory secretion. And when a person infected and they cough, sneeze, or talk, they can actually infect other people through the mucous membrane, and infections can happen as well. And overall, the droplet typically do not travel more than 6 feet, around 2 meters. And one of the things we wanted to really emphasize on that, which is very fascinating, especially the cases we see in the United States, is this virus can be transferred through the feces. One of the manifestations of this virus is now diarrhea in some people. And some people, if they have diarrhea and they don't wash their hand very well, and if they touch the surfaces, they can easily infect other people. That brings this concern that if this is the situation, then if you buy food, I think probably you guys, a lot of you guys are gonna ask me this question. If you buy food from the restaurant and one of the people are making the food has diarrhea and shedding the virus, then putting the food in the plate or give it to you, or you can take it for takeout, this food can be still infected for a while. This is so important that we heat our food or putting in a microwave to be safe. The other things that the box that they put in the food as well, they can also, the takeout box can be also infected as well. We have to really clean that as well. And this is one of the main concerns. The other thing is touch, because this virus can stay in especially plastic area for 2 to 3 days. Some of the new actually finding is that can stay on the metal for 6 to 9 days. But overall in the air can stay around the 3 hours. Like if you are in the room with somebody has COVID-19 positive and that person either sneeze, talk, and cough, in the closed door area of around the 3 hours, it can stay. And that was something that later we found through the article was published in New England Journal of Medicine, that we have issue in the air, and we have to really be careful. This is exactly the same thing, and I show it to you, how many hours it stay. Plastic is the main one. Is actually the plastic can stay for 2 to 3 days, and we have to be very careful about anything we buy from outside and waiting for 2 to 3 days unless if we clean it very well. This disease is technically the median incubation period. The time you get the virus till you're showing the manifestation is around 5 to 6 days. But it's very interesting is that around, some people may show the symptoms on 8 days. Overall, 97.5% of people, they develop symptoms in like day 11 to 12. And it's very other interesting finding, it's in like, which is kind of scary, but it's not significant. From 10,000 cases, they actually have 14 days they were been in quarantine. 100 of these people show the symptoms after 14 days in some of the Chinese report that we got. But overall, something we say 2 to 3 weeks is the average time that incubation period, the maximums can be happen. But most of the cases within 14 days, we're gonna have the symptoms if they're gonna show the symptoms. Recovery time is around 2 weeks if somebody only have mild infection. Somebody has severe infections, usually takes the 3 to 6 weeks. Now we have some people that even they have 2 to 3 months in the ICU and hospital as well. Now, many people ask me the question, what is the initial presentation of the COVID-19? What are the symptoms that we can see? There are many symptoms you can see. I'm going to tell you a little bit about it, but the majority of the people is fever, feeling fatigue, dry cough in 59% of the people, not like 40%, they don't have a dry cough. Low appetite, anorexia in 40%, myalgia, which is a muscle pain in 35%, and shortness of breath in 31%. Some of them, they may have a wet cough, I mean, not a dry cough, and they may have phlegm in 27% of the people. And as you see here, there's a lot of other findings that you can see from fatigue, fever, headache. I wanted to especially emphasize on the diarrhea here, which is so important to know. And again, some of them, they may have a sore throat. The sore throat has been reported in some cases, and especially runny nose, but is not as significant as we see in other viral upper respiratory tract infection. Some people actually reported that may lose the smelling, and that's something that we have to pay attention. Headache has been reported in many people. Some people actually reported a loss of taste at the beginning. Interesting that some of the cases that we see, even some of them is become irreversible so far, means they lost their taste and still they've not, even they recover, they still have this problem. And the new finding, especially reported in the United States, in New York, is a neurological symptoms. Some people actually started to become hallucinating. Some people started to have some delirium, some stroke kind of like symptoms as well. It's not common, but we've noticed actually in more older adult people, if they have fever, some of the neurological symptoms, like they become absolutely unresponsive. I had a conversation with a couple of my colleagues in New York for the last 72 hours as a daily basis. We do phone conference with them. And then they telling me some of the symptoms that they see in their skilled nursing home people, that they have very, very interesting manifestations so far. Again, 81% of the people, they can have absolutely mild symptoms, and they may have no or mild pneumonia. And severe disease, it can happen in some of the other cases, and 14%, which they have some shortness of breath, they have some low oxygen, and they have a positive CT scan. And 5%, they go directly to ventilator. They're going to be critical cases. And they actually have something we call ARDS, which happens in all infection, adult, again, respiratory distress syndrome, acute respiratory distress syndrome, which is exactly the reason that people die, because they actually go to shock, they actually drop their blood pressure, and then they're gonna have a multi-organ dysfunction. And this is the situation that people die of this COVID-19. How it's diagnosed, we know it. There's a test we call RT-PCR, which is reverse transcript PCR. This is the swab they do from the nose, from your throat, they can also do it from the blood, they can do it from the stool as well. Really, the accuracy of this test, it depends on the sample type, kit, technician, how they actually have this kit. I mean, the sample, the stability of the sample is all important. Shipment time is so important as well. Turnaround, it should be around 24 hours for RT-PCR regularly. It's a very actually expensive reagents, and they have some expensive instrument as well. They need to have a trained staff. You probably hear as of March 18, Abbott has FDA approved the 15-minute test, which is not the RT-PCR, and the different mechanism. but any of them can be helpful for doing it. Now, a lot of people ask me this question, which we had it in this area. A lot of people, they have negative, but then later they become positive. How is that possible? Not negative means absolutely negative. It can be poor quality swab. It can be the virus is not still not in the upper area that when they swab it, they can actually get a good sample. And don't forget, the RNA virus, it's a mysterious virus. They can very sensitive, they can degrade so fast. And this is why some of the tests can be absolutely negative. I just read a report in CNN that one of the nurses has been symptomatic and the test was negative, but she's insisted that she's very symptomatic, and they repeat the test and it became positive. We have the many CNA also in the skilled nursing home in this area that they have a similar story. I mean, they have first negative, the administrator called me and said the person is still symptomatic. We asked to repeat the test and they become positive again. And the best solution the CDC recommend is this technically do it from multiple sites when you have someone with this situation. CT scan has been done in China. What happened in CT scan, we see the, if you look at here in my screen, you see the white area here in the lung, and you can see it here in the lung as well. This is we call ground glass opacities. And this is not typical finding for COVID-19 pneumonia. Every single pneumonia virus infection, they can have this finding. But the interesting about, as I said, a lot of people, even asymptomatic, they can have this positive. CT scan may be helpful to confirm the diagnosis, but it's not something that completely rule out, especially in a study has been done in China. It has high sensitivity, but really low specificity because it can be positive in other diseases. And also it can be expensive as well. But I hear in China, because of the lack of the RT-PCR, they actually made a lot of CT scan out of the hospital and they put the people on the CT scan. If they have a pneumonia, they take them to the special hospital. That was something in the month of January they've done there. Now, a lot of people, you may have this question, when can I be out of isolation? It depends on the test. If somebody do a test on you after isolation, you should have 2 negative tests, which is going to be here, at least 2 tests in 24 hours apart. It's been negative. At the same time, you should not have any fever, and you should not have any respiratory symptoms, including cough and shortness of breath. If 2 tests negative, plus fever and no cough, you can be out of isolation. If there's no test available, you can wait for at least 7 days, which is important to remember, 7 days of past the symptoms. And at least for 72 hours, you should not have any fever without using any Tylenol. That's very, very important, because a lot of people, they call me and they'll say, well, I don't have any fever in 24 hours, or one of our staff doesn't have fever. No, so if you take Tylenol, it's not counted. You should stop taking Tylenol. And if there's no fever in 3 days, plus there's no symptoms of cough and shortness of breath, improvement in respiratory symptoms, and at least 7 days passed from the beginning of the symptoms, you can be out of isolation. It should be more likely you're negative. Some people ask that, oh, my test is positive, but I really don't have any symptoms. And these people, when they can be out of isolation, if they have 7 days from the day that they have a test and they don't have any symptoms, they can be out of isolation. No fever, no cough, no shortness of breath, no muscle pain, no chills, nothing, only test positive. That means they actually, these people have a very strong immunity system. These are the people, if I was at the research part, I take their blood and they take their plasma after they recover, and they can be very good sample for plasma infusion for other people. Some tips for prevention. The people ask me about alcohol should be 70%. Bleach is actually very helpful. Either alcohol and bleach can be the best virus killer. Any kind of like wipe that you buy, they have either bleach or alcohol. Make sure if you buy any fresh vegetables or fresh products, fruits from the store, you definitely wash them with the soap and water. because somebody probably touched that. And we talk about it, the virus can stay for that area. And if somebody has like diarrhea and not really washing their hands, they can actually contaminate you. The best solution is that you make a soap and water in your sink, put all the fresh product there, wait it at least for 5 to 10 minutes, and then definitely scrub it and then rinse it with water. And that's very, very important for fresh product. For food, I said, if you buy food from outside, make sure put them in the microwave or heat them. Or if you have any food, you cook them. If you have the vegetables, cook them very well. Definitely for now, I will say avoid any wild animals or any farm animals. The reason I'm saying that, I'm not saying this is not my statement, because we're really not sure about the pets and animals. They may carry this virus, because so far we have no information about it, because this virus globally now is spreading. We really don't know. They may have this virus, but they don't have manifestation. A lot of people ask about surgical mask versus N95 mask. Let me tell you about it. Viruses are very, very small. They are, the COVID-19 is something around 60 to 140 nanometer in diameter. And one of the best things, when you use N95 mask, N95, it's not gonna let the virus come to you, which means protective for you. But surgical mask, when somebody has face mask, is if somebody is infected, it doesn't let the droplet go outside. It technically prevents the droplet. It doesn't protect you from not getting the virus, because this virus is very small and can easily actually get through the face mask or surgical mask. And technically for yourself, if you don't want it to be infected and you're exposed to someone that has the COVID-19, the best one is actually use the N95 respirator, which is going to be the best situation that you can use it. And that's something that a lot of people think about. But definitely now a lot of people, they are walking outside with N95 mask, or I see the people are running with the dogs in the streets with N95 mask. These are the jokes right now. But I'm just saying that for breathing and for being like a store or in the room, I will say definitely even the face mask to at least control the droplets can be helpful. I think it's just not that you protecting yourself. The people are sick are going to protect other people. And that's very, very important. This is one of the reasons they're talking about every single person in community should have a face mask. The main challenge that we have is a future. One of the reasons I wanted to share with you, I know that is something that may be a little bit challenging to discuss. And this is, I have a reason that I'm actually saying that, because I want to make a point. So far, as of today, April 3rd, we haven't had a crisis that we've seen in other places like New York, Spain, and Italy, Iran, China, so far. So I'm so glad, knock the wood. The main concern is if we have a lots of patients that they need hospitalization, do we have enough ICU bed and hospital for everyone? The answer is no. The one thing happened in Italy and Spain, probably you hear for the last week, the ambulance, they didn't take any older adult people to the hospitals anymore because there was no bed available. There's no rooms, even in emergency rooms, available. They ask all the older people if they have symptoms in the family to just let them die at home. Because again, there's nothing there. Now, there is one policy I want to share with you called age allocation healthcare resources. This is not a policy that is written, but this is a very important thing that we all need to know. If there's going to be an operation room and there's going to be one surgeon and there's going to be one young person and one old person, and surgeon only can do surgery in one person's because of the resources, they have to use the young, they have to actually take the young person to operation room. If there's going to be one ventilator and there's going to be one young patient and one old patient, they're going to give the ventilator to the young person. And that's the this is something that we saw it in observing the last 2 weeks in Italy and Spain. And this is one of the reasons that I have one of the slides, but maybe we're going to have this discussion. It is very, very important that we share our wishes right now in case of overwhelming situation, because in that case, it's going to be so late. And I wanted to tell you, if the people now go to the hospital, the families cannot come to the hospital. There's no one can come. There's only going to be a phone and just maybe conversation. And if somebody is very sick with a severe COVID, you don't have a time to even talk over the phone. It's going to be very, very bad breathing. I strongly suggest to everyone, entire community, which I'm saying is stronger, because in the last 72 hours, I talked to many of my friends at New York and who is taking care of a skilled nursing home. We asked them to please call all the family members of many older adult people and ask them again about their wishes, despite if they have advance directive, they have pulse form, anything else. Ask them one simple question. If they don't want it to be transferred to the hospital, if they don't want it to be intubated, please just ask this wishes again. Because if that situation, like in New York, you're probably here in Brooklyn, it's really, really overwhelming right now. And if now they have a space, they can transfer some of the older patients to other hospital. But if the situation in New York in the next 3 to 4 days is going to be overwhelming, then we're going to have a problem. Then we're going to go back again to the same conversation that we need to use the resources for younger people and just technically help the older people to be on comfort care. It is very, very important to just think about it. And again, and I encourage everyone to really think about these wishes. Now, some of the question you may ask me about that, can we have a vaccine soon? Let me tell you about it. There's no vaccine right now. We're thinking about maybe a year, maybe 1.5 years. I don't think so. I mean, I think it's just going to take more time. Think about RNA virus. They go to mutation so fast, and mutation is for COVID-19 is 2 mutations so far per month. Again, this is more slower than influenza virus, which is 8 to 10 mutation per month. But again, it just much faster than DNA virus. And it's very interesting things about this virus. The structure that we saw in this virus when it started in Wuhan, the one we see today is not the one that it was in Wuhan. This virus for the last 4 months has been changed. Now, the big question is that even if we have a vaccine today, is not able to control this virus, because this virus is going to be mutate. And that's going to be the big discussion we have. Like, it's the same thing for influenza. We're always getting influenza vaccine every year, but the next year, a lot of people, they still get the influenza vaccine because the virus gets mutated. And that's something we need to remember. Some of the questions that it comes to, is it truth, is it wrong? Can COVID-19 be transmitted through the mosquito bite? The answer is no. Can hand dryer kill the COVID-19? Hand dryer is not effective to killing any of this virus. Can ultraviolet lamp kill the COVID-19? Overall, ultraviolet lamp is helpful to killing the virus, but we should never use it for sterilize or skin, because it can cause the skin cancer, and we should not use it. But we can use it for sterilize the mask. This is the CDC recommendation, came last 24 hours, actually. I had a phone conference from the 7 o'clock in the morning about with the California senior care industry about this situation of how we can reuse the mask. Can thermal detector detect the people? Thermal detector is number one. Think about many people with COVID-19, they don't have any symptoms. And the fever, it's not in everyone. Fever is only in 44% of people that may have fever. When they get to the hospital, they definitely have a fever. That's why the scanner, it's not going to be very, very effective in finding that. I know that we're using an airport and many other places, but it's, you know what, it's okay to have, but I don't think that's really effective. We have many people came from the airports to this country and they had a virus and they contaminated many people. Spraying alcohol or chlorine solution destroyed the COVID-19. What about drinking alcohol? Well, alcohol 70% and bleach, I said that is actually helpful, but the drinking alcohol, it's not going to be helpful. It's actually, it's not going to kill the virus. It's you can drink it, you can enjoy your alcohol, but it's not going to kill the virus. The other question some people ask, if I have pneumonia vaccine, can I protect it against COVID-19? No, COVID-19 is a virus. It's not pneumonia. When you do vaccination against pneumonia, you technically vaccinate against pneumonia bacterial, which is a strep pneumonia bacterial. And this is why it's not going to help. The same thing for influenza virus. A lot of people start to rinsing their nose, mouth, and throat with salt water or saline. Can it helpful? No. First of all, there is a limited evidence even the regular rinsing the nose and mouth is really helping even with common cold. Or maybe some help with some people, they have allergy, but really nothing about COVID-19. There are a lot of people that start to rinsing their nose with salt water, ethanol. There's some people using essential oil. I hear in social media, they're actually selling lots of this product. Vinegar, no, I actually say no. That actually makes more mucous membrane damage and actually can increase the risk of getting more inflammation in your mucous membrane. I will say the answer is no. A lot of people start to taking tons of vitamins and supplements and probiotics, herbal remedies. You know, first of all, let me tell you something. Most of the study and research that has been done till today, they're not really indicating these products, it's decrease or prevent infection of COVID-19, even for flu or common cold. We have lots of the systemic review for like zinc. Zinc, it's not prevent you from not getting cold. Zinc is helping only to shortening the duration of the common cold, even not influenza. And it is very, very important to understand. And then regarding probiotic, there's only one study shows in kids that they have probiotic, they do better with common cold in compare of the kids that they don't use a probiotic. But that study was not a very strong clinical trial. And this is why it's just observational study. We have really no evidence that people taking more probiotic, they get less influenza. And we really don't have any data regarding this situation with COVID-19. A lot of people ask me about, do I have the immunity after the exposure? Am I going to be immune? No, antibody to the virus is induced when you have infection. Preliminary evidence so far shows that some of these antibodies actually are protective. But we really don't have any established data about that. We really don't know if the people are infected, they have really protective immune response and how long that can last. We really don't know. But overall, we really, one thing that we are now, it's working, if we can get the plasma from the people that are infected and they recovered, and we can have this plasma transfused to the people that are really sick and they are in the ICU situation. These are some of the studies doing it right now. We haven't had a significant data so far, but I will say it hasn't shown significant improvement. Maybe one or two cases in some other places, like in Spain, they are doing it, in Italy, they're doing it, in US, they're doing it. FDA is actually approved for running this study. We're waiting till probably next week to get some more data about if the transfusion of this plasma helped the other people. A lot of people start to taking medication, anti-malaria, and combination of azithromycin. Let me tell you a little bit about that. Plaquenil, which is a hydroxychloroquine, has been prescribed for many people that have lupus or rheumatoid arthritis. Maybe some of you actually taking this medication right now. It's let me tell you the story about it. This medication shows in the labs, only in vitro, helped in very rare cases of influenza to prevent from in the mouse, to prevent from getting influenza. But we actually, the study failed in the human when they started to do it in human. I think they did it in the rats. Yeah, they did it in the rats. No, they started this hydroxychloroquine in China in the large trial, which one of them is actually published just last week, and it shows it failed in people they actually took the Plaquenil for COVID-19. They have a very small study done in France, in Marseille, and they combine this Plaquenil with azithromycin, which they think about maybe some bacterial at the same time is affected. The study only done in 20 people, and only shows in 6 people they have less virus shedding. It hasn't shows that they do clinically better. They're less virus shedding compared to people that they haven't got this, and one of them left the hospital before a study. I don't know really that this is really valid study, but I know the FDA now approved as an off-label use because we don't have any alternative. Only things that I'm very worried about it, which I want to give you all this information. Combination of Plaquenil and Azithromycin are really cardiotoxic, means it can cause significant cardiac toxicity in people. I strongly recommend to make sure you consult with your doctor before taking this medication, because it can cause heart arrhythmia, it can cause cardiac toxicity as well. Last thing, we talked about it in the past. It is very, very important to talk about if somebody doesn't want to have transfer to the hospital and be on the ventilator. This is from the Switzerland, but we had this conversation for the last days also in the United States. We just strongly recommend to consider the palliative and comfort care for people that they don't have the wish to transfer to the hospital and be intubated as well. So far in Santa Clara, as of last night, we have more than 1,000. We actually have the highest county as far as like a number in compare of other counties in this area. And the number of the cases, I will say probably what I've seen today compared of weeks ago, it actually been much better right now. I mean, I'm very optimistic right now because we have less number of the death. We've been very successful in not spreading this infection in older adult population, especially in facilities. However, I have to say, for the last 48 hours, there is some very negative news that I hear. As you probably hear, many skilled nursing homes in Santa Clara County got affected. We have many cases in San Jose, many cases in this area right now, Mountain View area in a skilled nursing home, that people actually became positive. That's very, very sad news. The things I'm worried about it, that many of the nurses and the caregiver, because they don't have appropriate PPEs, they actually may be asymptomatic, but they are working in different facilities and they're spreading this virus around this community. That is one of the big concerns that we have. We are, with many of other physicians that in Stanford and also Palo Alto Medical Foundations, we are trying to make a team and get as much as the donation we can to provide PPEs, which is a personal protective equipment for staff, because they really don't have anything. And we try to provide as much as we can. We actually got many from some of our Chinese donors, which I was able to distribute it to some of the facilities. But many of the hospices company, they really don't have anything. Many of the skilled nursing home, they even don't have N95. We're hoping that we're able to get some more PPEs for people and try to really get funds and do it. Because if that's going to happen, then even May 4th, nothing's going to change. My main concern is after May 4th, if we are opening again this community and the people's going to start to traveling from other states to here, then we're going to have another surge of this infection as well. I mean, I'm glad because now we're able to control it, but I'm so afraid what happened after this 4 weeks when the thing's going to be open up again and the people's going to go back, going to go start to have business trip. And then they're going to bring the virus again and infect many other people as well. Especially till today, we have not been able to provide good the protective gears for our healthcare workers as well. Thank you so much. I really appreciate. Sorry, I talk a lot, but I just wanted to make sure some of these questions maybe is going to be the question that you have from now. But Emily, is all yours now.
Hey, thank you so much. We do have hold on one moment. If anyone has any questions in the next few minutes that they want to send onto chat, we can answer that. And as you see, Dr. Ayati has his contact information up. And I'll let that hold for a moment. And then I want to direct you to some final Avenidas information. So hopefully you have that down. And what I'm going to get up here . Okay, so we are really excited that this is just the first in a series of programs throughout the month. So we are going to be gathering every Wednesday throughout April. So you can mark your calendars, and I want to draw your attention that next Wednesday, April 8th, we'll be gathering at 11:15 a.m. And the topic is coping strategies for self-care during the coronavirus crisis. We are excited that our featured speakers will include Dr. Grace Nadolny, who's a geriatric psychiatrist, and I know she's on the call today. And we will also have Dr. Ayati joining us again. So if you have questions that come up between now and then, you can hopefully have them answered at that time. The two of them will share strategies to help elders, family caregivers, and those residing alone manage their stress, anxiety, challenging behaviors, and depression during this difficult time. So please make sure to sign up for that. And also on the screen right now, you're seeing contact information for the Avenidas Care Partners social work staff. So we have Paula Wolfson, who I know many of you know, who's the manager, and that's her telephone number and email. And we have Thomas as well, who is just connecting people with a wide variety of services and supports right now. One more opportunity to write down the website. We are updating it and adding information multiple times a day. So it can really be a great point of entry for anything that you need during this time. And at the bottom there, I have my contact information if you have any follow-up questions or feedback about this program. So I think that I will turn it back for one moment or unmute Dr. Ayati because I see there are a few questions that are coming in and we do have a few minutes here. Okay, give me one moment here. So Dr. Ayati, I will unmute you and I see some questions coming in. Okay.
Thank you. Yeah.
You are on. And can you see the chat questions that have come in?
Okay, chat questions here. Let me see. Let me start.
There's questions about home hospice availability.
Perfect. Yeah, home hospice availability. First of all, I will say yes. If people don't want it to be transferred to the hospital and they just wanted to have comfort care at home, they don't need to be transferred to the hospital. It doesn't require 72 hours admissions or anything else. It just, your primary care doctor can order home hospice for you, and the hospice can come home and provide comfort care at this situation. We all, again, we are hoping that we are doing our best to provide PPEs for the hospice team as well, because unfortunately the hospice team also, they're very struggling. But I talked to many hospice companies and they have some basic, we try to provide some, but hospice are available for if you need it, if you want it. It is very important, and I will emphasize, pick up your phone today. If you have any wishes to talk to your children or your loved one and say that if that situation's happened to me, don't do it. And the reason I'm saying do it right now, because the COVID-19 situation, when it happens to people, older adult people, we see a fast decline to the point that you're not able to even talk or really express your wishes. If there's any wishes you have, just talking about it right now. And if that situation has happened, that you're going to have a very bad symptoms of the COVID-19, then the family knows what exactly you need to do, or even you can inform your doctor, which is so important. Many of the doctors right now, through the telemedicine, telehealth, through the email, through the phone, inform them about your wishes as well. I emphasize again, I'm hoping, and I'm very optimistic that we're not going to have that moments in this area, but we never know. we may gonna see a similar situation that is happening right now in New York, and I strongly recommend to consider that. If you want it to be transferred to the hospital, that's okay as well. But just, again, make sure that everybody knows about your wishes, but hospice is available at home. That was one of the questions. Emily, if you can help me as well to see if there's any question for Dr. Home hospice, we talk about it. What about outcome in the people with cystic fibrosis? It's I don't have any data about cystic fibrosis, but definitely based on what we know about cystic fibrosis, can be very high mortality in people, because again, the people with cystic fibrosis overall, they have a very high mortality with any respiratory infections. I haven't seen any actually data about a specific, like a cystic fibrosis, that they have higher mortality. We don't know yet, but I can say for sure people with cystic fibrosis, they should be extremely cautious, extremely. Same questions go to any people taking immunosuppressive medication. Same questions go to any people they have asthma. Same questions they're going to have the people they've been a smoker in the past and they have COPD or chronic obstructive pulmonary disease. They have to be extremely careful, because this virus, whenever it starts to shedding to the lung tissue, it can easily kills many alveoli in these people. Will be posted on Avenidas. I think that you answered that. I care about my elder parents and need to shop for them. Can I tell them my best way to safely, can you tell me the best way to safely do this? You can shop anything you want. If you're not sure that your older elderly parents are able to clean and wipe the stuff or clean the fresh produce, definitely you do it for them and then give it to them, because it's so important. Like, for example, if you buy a box of like pasta or something, that needs to be wiped very well, either with the commercial wipes, alcohol-based wipe, bleach wipe. Even you can do it with the soap and water, but that needs to be done definitely before you putting in the house and just putting in the kitchen. And this is why it's so important, because everybody can touch this. And this is why important. This is the other, which I recommend to even my own patients, to like children, that when you do this shopping, you clean it for them and then give it to them. But we have to make sure children also, they don't have infection as well. I need to go in person. Yeah, that's true. There are not many items available on delivery services, unfortunately. Many of the stores, I hear like a Whole Food in our area, they don't do any delivery anymore. If you go by yourself, that's okay. I mean, number one is there is a special hours for elderly right now. It's going to be early morning. Yeah, it's just going to be fantastic. I hear the Trader Joe's has like 8 to 9. I think other stores also, they have a specific hours for older adult people. Use that hours because it's going to be less crowded. Definitely in a store, make sure that you continue following the protocol of 6 feet, again, apart from each other. It is very, very important. And again, whatever you put it in there, you put it in your shopping cart, try to not touch your face as much as possible. Put it in the car, come home, and from your car, one by one, wipe it, clean it, and then put it in your kitchen. If you put it in the kitchen, that's okay. Put it, clean it, and make sure you wipe entire your kitchen area after you put it, because again, your shopping bag can be infected as well. I'm not seeing what you are saying in website. Can you just, okay, I think there are just more questions, goes to contact info. Are there any studies available to see the situation? I mean, let me tell you about neighbor by neighbor. There is a big discussion today that unfortunately, and I think there may be some of the reason, California and Santa Clara, they are releasing the number of people, but the hospitals are not releasing the number of the admissions, their death and mortality. They said because people compliant. There's been discussion in the last days in many places, including KQED, There are a lot of researchers that really wanted to find more data about neighbor by neighbor as far as like infected people, fatality and all this stuff, but they don't release it yet. I think there is a reason for it. One of the reasons they are trying to first collecting the data. They don't want it to also people over panicking about the situation as well. I think maybe some of the other reason there, but I think it should be more transparent. I think it should be more transparent that we know neighbor by neighbor which area has more, but unfortunately I don't have it as well. What is the difference between taking the test with a health provider or a research tech company? Should be leaving shoes outside and have a separate? Yes, let me tell about the shoes. Shoes, it's so important. We strongly recommend that when you come with your shoes from outside, have a plastic bag outside, put your shoes in there and leave your shoes there. Because the virus can actually stay on your shoes for some days. Even we have the same recommendation for our staff in the hospital or nursing home when they come home. We definitely recommend them to take off their shoes outside, put in the plastic bag. And that's something, even for your scrub, like for example, medical teams, before touching anyone, make sure you change your clothes so fast, take a shower. The other things that actually a lot of people notice, the women, because of their hair, they can be infected as well. Hair is actually can be one of the area can be infected easily. And it is so important to wash your hair as well if you are going to the area that is contaminated. We recommend definitely with the healthcare worker to definitely make sure they wash their face, wash their hair very well, because they can be infected as well. Really, there's not any difference. I don't think there's any test by healthcare provider or research tech company. I think they're all the same as far as like a specimen, and then they do a test. I'm not sure about that, but I don't think there's going to be any difference. And there's a difference between sign of confusion to the virus and new onset of dementia. Some cases has been reported that people have some of other symptoms plus some mental confusion. Like for example, they have muscle pain, mental confusion, all this stuff. I will say for now, if anybody has new onset of confusion, hallucination, never had it before. I'm not talking about somebody had like dementia in the past and now having the symptoms. I will kind of consider to assume this is still COVID-19. I will say, I mean, I do it for my own patient, but I'm going to ask some other questions. Like, for example, is there anybody being around? Is the person has been exposed to someone has been positive? And again, ask some other question. Is there any loose stool, muscle pain? Is there any fever? Is there any cough? Is there any other associated symptoms at the same time that we have delirium? I will blame COVID-19 until I really get tested and find that is positive. For somebody with the new onset delirium, rather, I'm not talking about new onset dementia, new onset delirium, which is very acute confusion happening. It can be also somebody has baseline dementia, but because being in isolation, I think we're going to talk more next week about it, that they are more in isolation, their depression is getting worse. They actually may have delirium on the top of dementia, which is not related to COVID-19. I think the most important thing is definitely consult with your doctor to really make a differentiation. This is the delirious related to infection, or this is the delirium related to baseline dementia as well. Is it safe to donate the blood? Yes, actually we need a lot of blood. And again, it's safe to donate the blood. The blood is we actually need a lot of blood for people that are in septic shock right now. I think Stanford made an announcement that we need a lot of blood as well. It is very important to if somebody can donate the blood and in community to do it. And it is safe. There should be some protocol that they need to follow. I think I hear some of the stories that they definitely, the people are getting the blood these days, that maybe some asymptomatic people that are COVID positive, they definitely needs to have a 95 mask and definitely cover their face and all this stuff to do it. And the people, when you go to any facility, now I know from a Stanford side that for the last week, they're really following the CDC guideline if you go and donate your blood. None of the doctors' outpatient clinics recommended to be open. This is the recommendation for health department that, for example, if you go to any specialty clinic, any primary care, it should be closed because the doctor's office can also be a place that you can get infection. The Medicare removed all the, again, the barrier for having telehealth conference, telemedicine, even phone visit with your doctors. You can have phone visit with your doctor that is actually covered by Medicare. Right now, I'm still doing the geriatric consult for people if they need to have any geriatric consult, but everything's going to be either through the phone, FaceTime, or video conference right now. And this is something we recommend to everyone doing it. Even we recommend to the doctors to do the same thing in the nursing home as well. As you probably hear, even now we have the same system in the Stanford ICU as well, that even the doctor's visit is going to be happen through the iPad as well, unless if they need to do a procedure, they can go inside. But a lot of the Fort is actually doing everything remotely and through the conference system, I mean the video conference. If all of the nursing home and assisted living facility memory care are being tested, no. None of the assisted living nursing home, they're not. We don't have enough tests. We still have a problem with testing people of patients. I mean, even the health department we still have a struggling with it. I hope that is going to happen. This, if we follow the model that happened in South Korea and Germany, that they actually tested everyone, and then they separate from infected people from non-infected, that's the only way that we can contain this virus. Unfortunately, the answer to your question is no. They should do it, but we don't have a taste. How do we know if our home caregiver and this workers are safe? We don't know. I mean, honestly, we don't know. They can be positive. A lot of asymptomatic COVID-19 people in the community, and we really don't know. I will say probably the best answer is going to be by luck. If you're lucky and our caregiver is really not positive. But and my suggestion, if there's a possibility that your caregiver can wear the face mask or surgical mask, if it's available, do it. Because if the infected person wears the face mask, then we can protect the droplet. And this way it can be safer. But definitely for touching, we have to make sure that the area is going to be very well cleaned. Then definitely the caregiver with washing the hands more frequently can actually recommend that. If we bag our shoes after being outside, how long will viruses stay on the shoes? The plastic area shoes, it can be 2 to 3 days. The main thing is that you don't bring your shoes inside. And if you wanted to leave your shoes for 3 days, you can leave it for 3 days and you can have it again. But you can wear your shoes again. The only thing is when you come back, you're definitely going to remove your socks and then put it in another plastic bag and putting in like your washer. But definitely leave your shoes outside. You don't need to change your shoes. The main goal is that you leave your shoes outside and not bringing inside. Even if you don't want to put in plastic bag, don't put it in a plastic bag, you can leave it outside. The main thing is that we recommend don't bring your shoes indoors. And then you can have it again if you go tomorrow. When you come back, make sure you take off your socks and putting in like plastic bag, wash your hands very well and put it in the washer. And should we take our loved one out of care facilities if we manage them at home? Answer is yes. I actually had many personal patients, private patient of mine, that they are in the care facilities and they took their parents out of the facilities and their loved one, and they took them home. I think I will say probably for the last 3 weeks, I have like 4 or 5 patients of mine. They actually did that, and I recommended to do that because there's been some cases on that facilities. Yes, that's going to be a good thing if we can do it. If we have this ability to do it, I will say yes, that will be much better to do it. Are homemade face masks effective? They are effective as surgical and facial masks. They're not like N95 masks, but it's good if you are having a caregiver or somebody come to your home and having this home face mask on the face to help to prevent the droplet at least to the area. Does a t-shirt work as yeah, anything that technically covered the we'll call it T-zone, which is technically from the bridge of your nose all the way through the mouth, down to the chin. If you cover this area very well, then it can be a scarf, it can be anything. It can be anything you can use in order to protect. This for the person is positive. Means if somebody's positive and having this, again, the covering the area, it helps other people to not getting infected. But for you, if you don't really want to make sure that you don't get infected, if you have someone, then the answer is N95 mask. That will be the most helpful. I think we answered most of them. Is there any other questions in here? Emily?
Okay, Dr. Ayati, I think we are going to pause for now. So please take a look. Hopefully you've been able to get down the contact information of Avenidas, and just final reminder, so please make sure that you register for the event on Friday, excuse me, on Wednesday. And what I'd like to do is, if Dr. Ayati, if you're able to, I'm going to stop my screen share, and if you're able to put up your contact information one more time, it'll give people an opportunity to get that going. So otherwise,
Sure.
wrap up right now, and please check our website, avenidas.org, to take a look at this recording, share it with others, and contact us as needed. So Dr. Ayati, if you can share that, wonderful. All right, thank you for joining us. We really appreciate it, and I hope that you stay safe and well in the coming days, and hopefully I will see you on Wednesday. All right, thank you.
Thank you, Emily. I
So much
appreciate
for
it.
your time and knowledge on this topic. So we'll see you soon.
Thank you.